My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Dr. Maura Moynihan is one of the most amazing healers I've ever been around. She is also my cousin and one of the biggest influences in my life. She has endless heart and compassion. Her aura and energy fills the treatment room like no other doctor I have ever met. Dr. Maura is a healer on every level, physical, mental, and spiritual. She does many different types of treatments other than chiropractic that are so valuable, and she gets amazing results. She specializes in kids, pregnant women, and spiritual psychology. Please welcome Dr. Maura Moynihan.
Oh, Kevin, you're the best. That was really sweet.
How are you, Maura?
Good. It's so good to see your face.
I know, it's been a little bit.
It's been a little bit.
So, Maura, where are you from?
I am from Long Island, New York.
Long Island, New York.
Long Island, born and raised.
How was it growing up in Long Island?
It was great. It was full. I was the oldest of 6.
Oldest of 6 kids.
My whole upbringing was really based around just caring for my siblings. Watching my mom and her pregnancies really influenced me in a way that I didn't even recognize until I got older.
You grew up babysitting.
Grew up babysitting. Yeah, that was the thing. And yeah, really close-knit. Like, loved spending time with my cousins. Loved spending time with just our extended family. And when I was in elementary school, though, I got sick very often.
What'd you get sick?
Strep throat every month. Like, I was out of school every single month for strep throat or tonsillitis. So much that I'm actually really surprised that they didn't take him out. But that's what led my mom to seek a different type of care, because the chronic doses of antibiotics were clearly not effective. And that's when she took me to my first chiropractic visit when I was about 8, I guess.
And did that help?
It stopped getting sick. So then everybody in my family started going to the chiropractor, and it was like just a part of our care. And how influential that was. It's huge.
Absolutely. That's funny you say that, because I used to get chronic ear infections, and I was on antibiotics like probably once a month as well. And my mom didn't know any better. She's like, that's what you do. You go to the doctor, you get antibiotics, and that's that.
It is so true. Yeah, you don't know until you know. And then the whole game shifts.
So you also played some sports in high school, right? You were a big runner?
Yeah, I paid for a lot of my college for running. And it was when I was in my freshman year that there was a woman chiropractor in the athletic training office, and she was there. And I thought she was so badass, because she would come in and she would adjust the football players and the lacrosse players and everybody. And I was like, that combines both things, like helping people and sports. And so I talked to her, and she really impacted me, because she was like, as a woman, I wanted to have a family, and I needed to make my own hours, and I can help people on my own terms and support the population that I really feel called to supporting. And that really stuck with me. So I started my chiropractic adventure really being clear that I actually was going to focus on athletes.
What were some of the stuff you were dealing with as a runner?
I had a lot of lower leg, like a lot of tightness in my calves, and shin splints was something that I was really working with often. So that was my Achilles heel for sure.
So after you saw that chiropractor and college was winding down, did you know immediately that this is what you wanted to do, or did it take a little bit?
During college, I had a neighbor across the street who was this phenomenal woman chiropractor, and she worked in the city, so I started to shadow her during the summers, and that really solidified it to me, because I was like, oh, look at this woman making a difference, going into this city, and then she worked 3 days a week, and she was there for her kids, and just had this lifestyle that I was like, oh my God, it's the best of both worlds. And it really shifted my whole paradigm of like working hard and paying your dues, and to like, no, like live your dreams. Who am I not to accomplish what I set out to accomplish and support people the way that I want to support them? So those two women were hugely influential in me being really clear that this was something that I only applied to one school. for a chiropractic school. I was like, that's where I'm going. I'm sure you can relate, Kevin. And so I went, and I thought I was going to treat athletes, but then that shifted.
Did you pick that school because you always wanted to live in California, or was that what drew you to that school?
You know, I picked that school because my neighbor who I shadowed went to that school, and she just embodied all of these qualities that I was like, I want that. And the way that she shared her experience in California, and that's where she met her husband, and like they would go skateboarding in Huntington Beach, and I was like, yeah, like if I'm going to study my ass off, I do not want to do it in upstate New York again. Like, bring on the sunshine. So yeah, it was really clear, and it was one of the best decisions I've ever made.
Yeah, it's funny when you tell people, like, you went to school in California, it's like, how did you ever concentrate? If I ever went out there, I would never get any work done, but
Totally.
I think it's the opposite.
Yeah.
Like, it's so nice out that you want to get your stuff done and then start enjoying yourself. I think I might have studied more out there.
I totally am the same way. Absolutely. Like, get me out in the sunshine. I want to be out there. And I don't want to be thinking about all the things that I need to do, so let's just get it done. Totally.
Yeah, I remember when we all came out for your wedding. I remember me and Timmy, like, sitting on the top level of the hotel in Burbank, looking out at, like, the mountains and everything. And I'm just like, this is where I need to spend at least some time of my life because it's just absolutely beautiful out there.
Kevin, you've always had these inner knowings of such clarity of your next steps. I've always appreciated how you've just been like, that, and I'm going to live in Huntington Beach, that, and I'm going to go back to New Jersey, that. Like, you've had these stepping stones that you've laid out for yourself. It's really beautiful to witness you.
So you went out to chiropractic school and you were a dual major, right? You did acupuncture and chiropractic, right?
I did. I didn't start that until after the first year, and that was crazy.
Oh, I couldn't even imagine.
So you go to school all day, like 8 to 5 some days, and then I would have class from 6 to 10 for several nights, and so it was really intense, but the thing was that I loved it. I had really irregular menstrual cycles, and then acupuncture completely healed that for me. 100%. Like, it was such a clear yes inside that I was like, this is really important, and this is healing. And that, I feel like my experience having gone through the acupuncture program was that really opened my eyes and my heart to all of the modalities of healing. I'm so grateful for chiropractic. That's such a foundational tool, and there's just such a growth and a blossoming off of that for me.
Well, what I noticed about you, too, is you have an extraordinary curiosity for every type of healing. Even if it's something you don't want to do, I feel like you look into it, feel it out, and then it's either you go in that direction. Because you do so many things that are so great. I feel like some people are very straight-minded and know exactly what they want to do, but they kind of shut other things off that could actually benefit them. And from where you started to where you are now, did you ever see yourself going in that direction? Because it's just, you broaden your aspects like unreal.
I remember that I was very clear that motherhood and chiropractic were going to be such a strong connection for me, and I didn't really understand how until later on. But like, that was one of the foundational interests for chiropractic. Like, oh, I get to have a family and have a career that I can create in the way that's going to fit for me. But no, I definitely would not have thought that I could just express chiropractic and healing in the way that keeps on evolving, because oh my gosh, there's so much to learn, and it's endless, and it's all about, for me, just like, I can have respect for something like acupuncture. I honor and respect, and that is not something that I practice, but oh my gosh, I have reverence for it. And so it's just like a sifting through, like, what lands, what fits, and that's how we find the healers that resonate with us, right? We all offer something a little bit different.
And you have a unique specialty where you specialize in pregnant women and babies.
Yes.
So, it's funny, like, I'll have people come into the office and they have no idea that they can even bring their kid to a chiropractor. And we get such amazing results with kids.
Amazing.
Because they're so young and they heal so fast. And it's like, you can see miracles happen very quickly. So could you just talk about just treating children, what you've seen, what they respond really well to?
The majority of my pediatric population that I work on are newborns. specifically those that have a difficult time latching, nursing, taking the bottle. And so what I find to be particularly effective with that is doing a combination of craniosacral and chiropractic. I find that a lot of times it can be a structural inhibition, whether it's a tighter frenulum, a tighter jaw, but the tighter jaw is merely a compensation for something that's not working right. Torticollis is something that a lot of babies have from a result of just too much force from being born, whether it's just a long time pushing or obstetricians kind of pulling. And as we know, subluxation in the upper cervical spine, it's really, to correct that is just the biggest service that we can do for a body, especially one that's developing and growing. So yeah, I've seen tremendous things. For example, babies that are considered failure to thrive because they're losing tremendous amount of weight, and we just release the tension and subluxations and in their cranium, whether there's cranial bone overlap, they'll start eating properly, they'll start pooping properly. It's pretty huge. And then I really love supporting babies who have a harder time meeting their developmental milestones. Although it can be common that babies don't crawl in the cross-crawl pattern, that's not normal. That's a really important developmental milestone that affects how we comprehend reading later on in life. It affects how we coordinate later in life. It affects not only our pelvic alignment, but it can also affect our eye tracking. So catching that and supporting that, that's something that's just so gratifying and humbling to see, because that stuff takes like one session and it's a game changer. Adjusting S2 is like, it's just huge.
And everything you do is very gentle, very light. It doesn't take much at all to realign the babies, right?
No, not at all. And like I said, I really like the combination of the craniosacral with the chiropractic, merely because the craniosacral can do a lot of the unwinding for us, and it can really help diagnose where the pull is coming from. Like a lot of times when babies have a preference to look one way more than another, or have an easier time latching on one breast rather than another, it comes from the neck, but I've seen it come from the pelvis, and it can come from the diaphragm, and it can come from other structures that have just been compressed in the womb. So I find that craniosacral is really helpful in diagnosing where the pull is coming from.
Right. And even babies that are just constantly on edge and they seem restless, they're not sleeping through the night, you probably see that all the time where you realign them and they're back sleeping again, they're uneasy, they're not crying all the time. I feel like there's probably a lot of moms out there that just, they don't know what to do with that.
Yeah, there's such a helplessness, and, you know, they go to their pediatricians and, you know, they're just, the babies are put on some sort of drugs a lot of times, whether it's a reflux medication. That's the most common one that I see. And to medicate a tiny baby where it could just be a subluxation that's happening is, yeah, to educate the public is really important about the benefit, the gentleness, the efficacy, the long-lasting effects of getting care. It's huge.
And what might be even more important than babies is helping women through the pregnancy process, right?
Amen, brother. A huge part of my practice is utilizing the Webster Technique.
Which is a technique specifically designed for babies and pregnant women, right?
So it's most commonly known to support babies, to create a space for the babies to be in their ideal positioning. So it's most often sought after when a baby is breech or transverse. I like to do it on all of my pregnant women, because who wouldn't benefit from having a pelvis that's like encouraging the ideal positioning? And it's a game changer. I've had women come in like limping, walking sideways into leaving the room, and it's not only just a sacral subluxation, it's just uterine ligament holding, and releasing that is huge. And it's so beneficial because you have so much relaxin in your system when you're pregnant, and especially towards the end, that it really doesn't take very much. And you can correct like old chronic misalignments and dysfunctional movement patterns really effectively with not a lot of sessions.
Right. And what's good for the mother is great for the baby as well.
Always.
I'm sure you see this all the time, but at my internship, this one woman, she got an ultrasound and the baby was breech. And then the Webster technique was done on her, and the baby flipped around and it was in proper position again, all through just that ligament work around the womb. That alone just did it, and I was just absolutely amazed by that. Absolutely.
It's a tremendous tool. It can help so many people. And like you said, it not only helps the comfort of the mom, but it helps the comfort and the space for the baby. It's really huge.
And could you talk about a little bit your experience with the natural birthing process?
My own personal experience?
Or just like in general, because like water births, and just, do you feel like that's more beneficial can it be more beneficial than going to the hospital? And
that's such a great question, Kevin. I love working with pregnant women, and what I have sincerely found is that when a woman needs to open her pelvis in order to birth, she needs to feel safe. So certain women will feel safe based on their history, based on their upbringing, whatever, in a hospital setting. And so it's God bless. If that's what you feel safe in order to birth your baby, for sure, let's just really be cognizant of not having interventions. Let's support you as much as we are able for you to feel as calm, have your nervous system in a place where you feel like you can connect with yourself, get out of your head and get into your body and do what you're designed to do. I've found that for me and for most of my patients, because I work with predominantly midwives who specialize in home birth, who specialize in water birth, who specialize in having it at a birth center, that population knows about coming in for wellness care, knows about coming in for preventative care, knows that it's going to be in the highest interest of the baby to come in and get checked after the birth. And so I feel like my role for those women is to give them tools and practices that will just help reinforce them to feel empowered to birth the way that they want, and for them not to judge themselves if things happen that are not aligned with their ideal scene, because life happens and we don't want to create a scenario where they're going to beat themselves up over some things that we can't help.
Definitely. Yeah, because the baby, they'd start taking everything in from the first moment, right? I feel like a lot of people kind of shut that out. This little beautiful baby's so young, it's not taking anything in yet, but you're processing everything from day one, right?
Well, my understanding is that, they're in your space. So when we feel stressed, they're going to feel the stress. And I'm really cognizant that I say that sometimes women hear that and then they take huge responsibility and they're like, I have to be perfect. And I've seen time and time again when women are like, I must create the perfect setting, that they kind of push things down and they don't allow themselves to have a human experience where life is still going to happen and things are still going to happen, and feel your feelings, and let's give you some tools so that you can kind of come back to your center and remember what it is that you're here to do and what your plan is for your baby and your life. Because sometimes I know that when I had my first son, there was a lot of talk this is good and this is bad and this is right and this is wrong, and it was that feels not really supportive for my nervous system, because there's a lot of contingencies on that. So I want to support the woman to feel safe, because then her nervous system is going to be in a place where there will be less likelihood of interventions, which is in the highest good for the mom and the baby. I want to support the woman to know that she has tools and choices. So, my sessions are definitely there's a lot of coaching that happen as well as body work, and that's just my style. And the last thing I'll say about that is the right-wrong thing, home birth is better than hospital birth. I've seen so many women who have gone into postpartum depression because they've put on all of these demands upon themselves, where sometimes it's awesome and aligned, and then sometimes other things happen where they're doing the best they can, and that's more than enough.
They plan for a natural birth, but
something
life happens,
happens,
complications happens, and they have to go to the hospital, but that's perfectly fine too, right?
Right.
That's pretty much what you're saying, yeah.
Yeah, I mean, we do the best we can, and then if other things happen, we have other tools. You come in for care. I had a really long-term patient who had to have a cesarean, and it was after she had a VBAC, and she was depressed for a year and a half, because she felt like she was a failure because she didn't...
What's a VBAC?
Oh, good question. A VBAC is a vaginal birth after cesarean. So she had 3 children. Okay. She had a cesarean, she had a VBAC, and then she had another cesarean. Just because her body, it was not good for the baby for her to push. So they had an emergency cesarean. And she did everything right, quote unquote right.
Right.
And that's just happened. So experiences like that, it really solidifies inside of myself that like how to best support a mother's nervous system is to like not have judgments, to educate them, to see what fits for them and their family and support them there.
Yeah, definitely. Well, when you get a treatment from you, it's completely different than, I mean, I've seen a lot of chiropractors and healers, and you get the full mind, body experience. You connect pain with emotion. You peel back layers. Like, I'll have a session with you and you ask all these questions and I don't even know I'm telling you all this. And then all of a sudden I feel like I just release and the pain goes away. And you connect things that a lot of other people don't do. Can you elaborate on just bringing the big picture together, I guess, in a treatment?
Sure. So it goes back to, I guess, my definition of what healing is, and it goes back to my master's degree in spiritual psychology, and a big tenet of that is healing is the application of loving to the places inside that hurt. And I'm sure you've seen this in your experience, Kevin, like people will come in with like a chronic subluxation, or they'll come in with a chronic area of pain, and like we're not just our bodies. Maybe our body is actually trying to communicate something to us. Granted, if you were like in a car accident or you like slammed your knee into something, like there's of course, there's pain for that. It's just looking at the body as the vessel that it is and understanding what it's being communicated through. So I have had some huge healings for myself personally with chiropractic. And also, with that being said, the flip side of the coin is I've also gotten adjusted time and time again with no relief in certain times of my life. And because it wasn't a physical thing that I was working on. It was more of an emotional thing. It was more of a mental thing. It was more of an unconscious thing. And so when someone comes to me, I try to hold a space that I'm giving them the dignity of their process and that they're not coming to me because of necessarily a physical dis-ease. They very well may be coming for something else that is just being translated as that. So it really can resonate with some people, and other people are like, can you just rub on that tight muscle and can you just like make it go pop? And I get it, and so I can do that. I just find it so much more gratifying to dig a little bit deeper. And certain people are into that and certain people aren't, and that's totally awesome.
Definitely. And like another amazing thing that you do is you don't work always in the area of pain. Mostly you don't, because I've thrown my back out completely where my left hip or left lower back hurts, and then you'll work on my right shoulder and everything will release. Everything's connected, but talk a little bit more about that.
Oh, yeah. So, you know Rolfing, the technique Rolfing?
Yes, I've never had it done, but I've heard great things.
So the woman who is the inventor, I guess is the word I want to say, Dr. Ida Rolf, she had this great phrase, and she always said, oh, I'm going to totally mess it up. It's like, where you think it is, it ain't. You keep on having this chronic right SI joint that keeps going out. You've adjusted it 500 times. Clearly, that is not where the dysfunction lies. And so I really, really find tremendous value in the practice of NeuroKinetic Therapy, otherwise known as NKT. And
that technique is amazing.
It's amazing. And Kevin, I just took the third level, and it's like blowing my mind how it just goes back to movement patterns and dysfunctional movement patterns. So like you could have sprained your ankle 4 months ago, and now the pain, although your ankle is quote unquote healed, because of the compensations that you made way back when, your left hip is all funky. So if you're just going to be looking at the hip and not addressing the dysfunction in the ankle, you're not really going to get anywhere. So it's really like expanding the scope and seeing the human form in its highly intelligent ways of how the nervous system operates. And so to work on kids with that and support them as they're developing these movement patterns is so gratifying. Like, I'm just thinking of this one baby who had torticollis and would only roll one way and only crawl one way, and like it was just such a dominant sided thing. And I was like, telling the parents how important it was. Like, a lot of education has to go to parents because, like you said, a lot of people just don't know the value of taking your child to a chiropractor and communicating to them like, you don't grow out of this, you grow into it. It's just going to shift and morph, but this dysfunction is going to stay there until we address it. And the gift of addressing this within the first 3 years of life is foundational.
So NeuroKinetic Therapy, from my understanding and you treating me with it, is you are turning on muscles that have quote unquote shut off and addressing muscles that are working too hard to just kind of balance out the system. That could be completely wrong. I don't know. So
I love how you're saying it. And to be really clear, to use an example of if your right shoulder hurts, like seeing if you should stretch your shoulder or not, seeing if that muscle is firing appropriately. Sometimes muscles can be tight, but they can not be firing appropriately, and therefore stretching them would be exacerbating the problem. How many times do we see people with chronic hamstrings and they'll stretch them their whole entire life and they don't get any looser because they're working synergistically with something else, and if they let go and the other thing isn't working properly, the whole system gets kaput. So it's really a way to find these places inside that are talking to us, usually through pain or with tightness, and finding the relationships. So that's why if your hip is hurting, I'm going to go to your shoulder, because when we rotate our hips and our shoulder together. Or when we walk, there's that reciprocal inhibition where one muscle fires and the other turns off in order to effectively move. Yeah, it's just really fun, and it seems really magical, and people are like, what are you doing? And so that's, as long as they're feeling great.
It feels like you're floating afterwards. It literally just feels like you're floating.
Yeah.
It's unbelievable. I love that technique. And what I'm very curious about is your spiritual psychology background. Where did you go for that? Because everybody I talk to that's done it says it is either the best thing or one of the best things they've ever done in their entire life. That program. What is that program?
So I have my master's in spiritual psychology with an emphasis on consciousness, health, and healing. And I got my degree from the University of Santa Monica. And by far, that is definitely up there with the best decisions I've ever made, ever. And that just really changed the whole game for me. And of course it translates into how I care for another person, and it really clarifies how life is designed for you. So even when the big challenges come up, it's like, this is designed for you. How are you going to show up? How are you going to be with yourself as you navigate
That's why I think it's so amazing, is because not only are you getting this education, you're going to work on yourself. And not many programs do that. Usually when you're in a program, there's an end goal in mind. You're doing it to learn as much as you can, where this is you're learning and you're bettering yourself. And I feel like when those two meet, that's when you really get to see some progress and growth, because you're applying what you're learning to yourself, right?
Oh, the whole thing is healing yourself so that you can show up and be the presence of love for others, for sure. And then having the experience of like going through the healing and like going through the process of loving the places that hurt, like going through the hurt, because so often we're taught like, oh no, you're fine, no, you don't feel that way, no, you're okay, and like not validating, like, no, actually I'm hurting right now, and now I don't even know I don't have any tools, and like, what do I do when I'm hurt? Push it down. And that's what causes illness and dis-ease. So like owning it for oneself, it's like, oh my gosh, of course you can show up for another in that way.
Definitely. Yeah, it seems like it's a great Do they do that online now?
They have offerings online. I don't think they offer the masters anymore. Now they're doing this certificate program, but like whatever they offer is extremely valuable. I retook the third year, the consciousness, health, and healing, because it changes everything. I volunteer there as much as I possibly can because I just want to be a part of it. I want to support it. Like, it's where miracles happen. I love it.
Yeah. I feel like the people that do the best under any treatment that I've seen personally are people that meditate a lot and people that do some sort of yoga or just any type of meditation. Even if they're in extreme amount of pain, they have that mind connection with their body. So when you do remove the structural interference, they're good to go. They take it and run with it. I feel like they hold their adjustments longer. They're just very in tune with their body and what's going on. And I feel like they heal up faster rather than people that are they're just not in tune with their body and they just kind of shut things out, push things down. And I feel like those people are always in the office just looking for something, suppressing everything. But I've noticed the people that meditate a lot and just that are conscious of their body, they do really well under care, because I think they have that mind-body connection that helps them heal faster. Do you notice that too?
Oh, absolutely. I mean, absolutely. Those are the people that just come in for wellness care and like self-nurturing. They usually don't have a lot of pain.
So what are you up to now? What's new?
Well, funny you should ask. So Jason does his breathwork class, and he's been traveling quite a bit.
Oh, I love that.
Absolutely. So I've been subbing, and that's been so much fun and so inspiring to me. I love it when I sub. It's great. I love to witness people working really hard to heal themselves in a different capacity. And I had this awareness that I felt like my service was changing. Like, I felt like my service in the world was just kind of shifting. And that week, 2 people approached me for coaching. So I am doing that too.
What do you mean by coaching?
Being a life coach.
Right, yeah.
Which was a little bit daunting at first, but then I remember that's essentially what I do with my patients anyway. This time I'm not putting my hands on them.
Right. So they're coming to you strictly for just coaching.
Yeah.
Do you see yourself implementing chiropractic or any type of healing on them, or are you just going to just stick with the coaching, or...
Yeah, it's a great question. Well, the 2 people that I'm doing that with now, well, one of them moved, and so she was a patient of mine, and then the other one is a midwife that I've worked with forever. So I don't know, I'm kind of just being curious of how it's unfolding. Like, it's an added thing that I can do to support them, but as of now there isn't any physical. Yeah, so I don't know, something is happening and unfolding, and I'm excited about it, and we'll just see what happens.
That's great. I'm excited for you guys. I want to have an entire episode on breathwork because I think it's probably the best form of meditation I've ever done personally.
Seriously.
I don't even know how to explain it. It's an unbelievable experience.
Terry hasn't had it either, and he was like, I really want it before my wedding, so we'll probably do it before the wedding.
No way.
Yeah.
Oh, yes.
Right? Don't you think that would be so supportive, like before you celebrate your love, to have that? I subbed the other week, and Tom came, and Tom my brother, doesn't usually come very often, and when we were done, he was like, oh, that's cool. But then he told Terry, he was like, I could see my soul. my soul is orange. Like...
He called me after that session too.
What?
It must have had a profound effect on him because he was all nonchalant with you about it.
He was just like, oh yeah, that was cool. I like that song.
Yeah,
all right.
He says it's been working like wonders for him.
Oh, I'm so happy for him.
Yeah, that's great.
Yeah, it's a game changer.
It really is.
I just encourage everyone to just get the care and like be curious about what their modality is. Like, try a lot of different things and try a lot of different, like you did, try a lot of different practitioners, because there's so many different ways to apply healing.
Right.
So many different, and it evolves, like we know. So just being curious, and it's such an act of like love for our bodies when we take care of ourselves in this way.
And yeah, I think a big part of that is just being an open-minded person with everything.
Right. That is a really big help. That is for sure. Yes.
Yeah.
I think that like it's a painful existence when we are closed-minded, and that translates into our bodies for sure.
Definitely. Yeah, so holding on to emotions and suppressing memories and painful experiences, we carry that with us, right?
Yeah.
That can literally translate into physical pain.
100%. It translates into dis-ease in some form. It doesn't go away. Like, just like a child doesn't grow out of a dysfunction, an adult doesn't lift without moving through it, because it's for us. Like, when we do the work and we heal that pain and suffering, it not only frees us from that pattern, but it frees up our, like, generational, like, we don't pass that pattern down to our children.
Definitely. That's a very good point. Yeah.
It's important, and it's for us, and it's work, but it's the best kind of work.
Would you say your treatments build off each other somewhat?
100%.
Yeah?
Yeah, 100%.
So it might take a couple sessions to work through, because it's almost like probably like peeling back layers of an onion. It takes some time to get through everything.
Absolutely. And I mean, and Kevin, as long as we're in a body, we've got shit we got to work on.
Right.
So that's where it's like wellness care. Come in and we'll just keep on working on it so that you can show up the way that you desire.
Right.
So that you can help yourself and help others.
Right. And not being afraid to let it go. Like you probably have people crying tears of joy or just going through an old experience in your treatment and they're just letting it out. And probably 20 minutes later, they feel so much better. They finally got that out and they released that.
Yeah. And the most important thing for that is being like a safe space, you know, so just not having judgment and knowing that everyone's everyone's on their own path, and we're all doing the best we can, and just honoring that person's path.
Definitely. So, Maura, where are you located? How do people find you?
Well, I'm moving my office, but you can always find me through my
moving?
I'm moving, yes. I have 2 very strong leads, so we're in the process of that. But my website is rosewoodhealing.com, and all my information is on there. You can find me through there.
That's great. I'm sure you're going to miss your old office. Just walking. That is the most amazing. Every time I tell people like what your office is like, they're just like in awe. Like that's just
pretty great.
Great. Like Dr. Maura Moynihan on the fence. You walk around to the back, and the back room in the house is the treatment room, and it's great.
It was really great. We had a good ride.
Yeah.
It was a really good time, and I know the next one will be.
Where do you think you're? What area of LA you think you're leaning towards?
I want to keep it close. I want to keep it within like the 3-mile range for sure. So, yeah, it is being clarified right now.
Well, thank you so much, Maura. I love you so much.
I love you, Kevin.
This was a fun time. I'm glad we did it.
Me too.
Definitely want to have you on again.
Oh, thanks. Thank you for this. This was really fun.
Thank you, everyone, for listening. My private practice is located in New Jersey at Montclair Upper Cervical Chiropractic. If you have any additional questions about today's podcast, other episodes, or any questions about Blair Upper Cervical Chiropractic in general, feel free to visit my website at drkevinpecca.com or subscribe to my YouTube channel at Dr. Kevin Pecca. Hope you enjoyed the show. Cheers.